that doesn't always translate to what the bottom line is. And that's, again, a tough pill to swallow.
My name's Collin Hart.
And I'm Andrew Maller from VMG Health. Together, we'll talk about some of the business topics that physicians don't learn in med school.
In this video, we'll talk about proper expectation management in terms of establishing the value of both your practice and real estate. So Andrew, as you're entering a transaction with a client, would you say that they typically are pretty logical about the value of their practice?
That's a good question, maybe a loaded one, but I don't necessarily think of it as a logical versus illogical thing. I just think there's a lot of emotion that goes into this, especially if you're selling your practice, and maybe you've had your practice for 30, 40 years, and it is a very important part of the community that you serve. And so you have a lot of emotional connection, and unfortunately, sometimes that translates into when selling the practice, whether it be to a junior associate, a private equity-backed company, another practice, a brand new buyer, sometimes that creates valuation discrepancies between the buyer and the seller, because how I perceive the goodwill value of my practice might be different than how a buyer looks at it.
Might be different than how much work and blood, sweat, and tears you put into building that practice.
Correct.
Versus an investor just coming in looking at the cash flows.
That's
right?
correct. And unfortunately, that's sometimes a difficult pill to swallow for physician owners, because unfortunately, it gets boiled down to a number of, for an investor, what the EBITDA is. But EBITDA is an outcome of everything that goes into it. The staff that take care of your patients, the community that you serve, all of that, again, over lots of years, that doesn't always translate to what the bottom line is. And that's, again, a tough pill to swallow for somebody to say, well, I think my practice is worth a lot more than what the buyer might see it as.
Right. And we talked about it in another video, but probably it makes sense to try and clean up your books in advance of a transaction to help increase your EBITDA, all in a strong going forward manner, with the goal of optimizing the outcome, right? If you believe that your practice is worth X and the market's saying it's X minus 5, well, maybe working with a firm like yours or working directly with you can help clean things up.
Yeah, I think the first step is actually understanding your numbers. That could be, and this is not a, hey, we want to sell tomorrow or in a month thing, but always going through a process where you're understanding your numbers, what they mean, having, reports that you tracked, certain profitability metrics or benchmarks that you might track in the practice, just to understand your numbers, understanding what the key variables are that drive profitability. Oftentimes when looking at that and trying to clean up the books, well, staffing is our biggest expense. Maybe we need to look at that deeper. And, almost every situation that I work in, cutting expenses is not the answer. It's growing the top line. It's increasing patient volume. It's all of those things. So it's not just cleaning up the financials, but it's also cleaning up the operations, the flow and efficiency of your practice. So it's a lot of factors. But yes, you should be looking at them well in advance, but from a strategic perspective that ultimately will help drive value. It'll also give you a realistic expectation of value before you enter that process, before having an emotional reaction to a buyer saying, it's probably worth half of what you think it's worth. And that's a tough conversation.
Sure. Well, I think with all the insight you've shared today, hopefully our collective clients are better positioned to have proper expectations surrounding the value of their practice. So thanks again.
You got it.